Okay, hi all, and welcome. Let me, sorry, start by introducing myself. My name is Lu Del Bello, and I am an Italian journalist living in the UK, and I do development journalism as well as science. So let me introduce our guest today. With us is Sarah Bosley. She's the health editor at The Guardian. Geraldine O'Hara, she's a doctor working with MSF, and she's been working with Ebola on the field in Sierra Leone last year in November. We have with us Charlie Cooper. He's a health correspondent at The Independent, and Kate Thomas. She's the editor for Ebola Deeply. That's a news publication that digs a bit deeper into everything related to Ebola with news and analysis. So welcome. Before we start a little premise, we would like to keep this quite informal and give you the possibility of asking all the questions that you want as we speak. So feel free to just raise your hand, introduce yourself, and ask your questions. Can you see me? I am blind. Okay, so I would like to start with asking to my panelists what was the main issue in their opinion and their experience during the Ebola crisis, and how the media dealt with that, and what was the main problem that they found, what went well and what didn't go so well. So over to you.
Okay, so I get to go first. Is that right? Right, there we go. I get to go first, evidently. So I need to say, first of all, that I'm a very privileged, very fortunate journalist, because I work for The Guardian, and we had a really serious interest in Ebola right from the very beginning, and that hasn't let up either. So I went out myself in December. I was out there for 10 days in Sierra Leone and Liberia. And The Guardian, unlike a lot of papers, has been willing to fund our coverage. So there was no question over it. When I said, you know, I've been writing about this in London, I really feel I need to go out there. And actually, I have some interesting projects I want to do. One in particular about the possibility of doing clinical trials, actually trying to find a drug that works against Ebola. That was the big project I had. So when I said that, they said, no problem at all, you must go. You know, that costs a lot of money, but they're willing to pay for that. And our coverage has continued, so we're doing it now as well. We're still doing it, but it's not me, it's not mainstream anymore. It's not run by the foreign desk, it's now run by global development, and that part is entirely online. But we have people in Africa, largely, who are doing that. So, you know, the real issue, I think, is that, you know, to go back, I'm only saying that because that I know that a lot of people, a lot of papers haven't covered it very well and have dropped it, and they only started to cover it when it became an issue for Americans and British people and other foreigners who were becoming ill. That wasn't the case for us, although it certainly did galvanize the coverage. It made it more of a mainstream issue than before.
And from this point of view, I think it would be interesting if you have an opinion on how the media covered the Ebola crisis in Italy. I think that would be interesting for us to know, because I know that the crisis was covered in a very different way here. So we have experiences from the UK and in general from the international media landscape, but I think there are lessons to learn for Italy as well, given we don't really cover foreign issues very much. And I think it would be important for us as Italian journalists to understand that what happens outside of our country really matters also for us. Okay. Thank you, Geraldine. Sorry for interrupting.
Firstly, thank you very much for inviting me to be a speaker here today. My name's Geraldine O'Hara. I am a practicing doctor in the UK. And in October and November last year, I was fortunate enough to be released from my normal job, and I went to work for Médecins Sans Frontières in eastern Sierra Leone at an Ebola treatment centre. Now, when I was going, I was due to go out for dinner with a friend, so I texted her and said, I can't come. Her brother is an editor at Radio 4 on the Today Today programme, which is a major kind of morning news programme. And he rang me immediately and said, will you do something? I'm not a journalist in any way, shape or form, but I was really frustrated by the response in the West from the media, where there was a lot of scaremongering, there was a lot of worrying about what might happen to us, and there wasn't a huge focus on what was going on for people in West Africa. So I agreed to do a radio diary, which was broadcast over about 6 weeks, several times a week, probably somewhere between 2 and 5 minutes, just detailing what my experiences were. And I got a really, really positive response from the general public in the UK, because I think people wanted to understand what was going on. From my point of view, as I said, one of the biggest frustrations with the media was that this outbreak had been going on since really March 2014. I don't know if any of you know that, because it wasn't really a big thing in the papers, it wasn't a big thing on television, it wasn't really a big thing on social media. It really only became a really noticeable phenomenon in August. And that's when people started being expatriated from West Africa, when Americans got sick, when a British nurse got sick, when hospitals in the West started to accept people for treatment. Now, one of the things I think I'd like to look at is how, as journalists, when you pick up a story like that that's so important, how you can persuade your editors and your managers to publish this, and how you can make people aware of what's going on in other parts of the world and why it's so important to us. And it's not just about us being infected, it's about what's happening to other people. Thanks.
Hello, my name's Charlie. I'm the health correspondent at the independent newspaper in the UK. Again, thank you very much for having us. I suppose for me, the biggest challenge of covering Ebola was the fact that, as Sarah mentioned, I was one of those journalists who wanted to go out to West Africa to see it with my own eyes and understand what was happening firsthand, because as you will hear from the testimony of the 3 people on this panel who did go to West Africa, there is no substitute for actually being in a place to understand an issue like Ebola properly. So the challenge I faced was reporting Ebola in a rational, in an accurate, and in a fair way from so far afield, based on official statistics, the testimony of experts I spoke to, the testimony of people on the ground, and that was a challenge. Particularly, it was, as Geraldine mentioned, much of the focus in Britain on Ebola was, oh my God, what does it mean for me here in Britain? So one of the common things that I would hear from colleagues and from friends, because they knew I was writing about Ebola, would be, well, should we be scared? Should we be afraid? I said, well, I would say normally, well, for your own health, no. But should you be afraid and should you be worried about the catastrophe unfolding in West Africa? Yes, you should. And Ebola was quite a strange one in that sense, because a crisis in a faraway land that meant little to a lot of people in the UK suddenly had this, it was seemed that this might actually impact their lives briefly, even though to a great extent they were wrong that it would. But in that sense, it brought attention to something happening far away, and that might well be into the future. We'll discuss this going later on. Going into the future, that might be a long-term impact of Ebola that actually ends up being a silver lining or something, but we'll talk about that later.
Okay, and my name is Kate Thomas. I'm the editor of a website called Ebola Deeply, which is a single-story deep dive website which was created just to take a look at the Ebola outbreak in depth and to cover it. We launched in September, August last year. Basically, so my background before this outbreak started, I was a freelance journalist in West Africa. I lived in Liberia for 3 years. I'd had quite a bit of experience covering other health issues in the region. When the Ebola outbreak first happened, we noticed, as other people have said, that there was a lot of hysteria in the media. Either it was undercovered as an issue, or it was covered with so much concern and fear that the real issues that had caused this outbreak and that needed to have more detail about them were not being justice wasn't being done to them. So I came together with some colleagues, including the CNN anchor Aisha Sese, who is Sierra Leonean, and we decided to create our own space where we could cover this outbreak in depth, where we didn't have any parameters, where we weren't subject to editors saying there's no space to cover this story. And we created a space where we could cover it properly and thoroughly, and make room for all the different voices involved in this outbreak, which included many, many local voices on the ground. So that's what we did. We've now been running since September, October, including lots of conversations with responders, lots of crafted pieces about issues on the ground, lots of aspects on the medical, the science, the drive for a vaccine, and then also focusing quite heavily on the impact on society, and the reasons why the door to Ebola was opened in these countries, and what can be done to prevent it in the future. So that's a little bit of background of where I've come from.
Thank you, Kate. So I have a question for you. You mentioned the fact that you wanted to create a space for you to talk freely and in depth about the pressing issues without being subject to the editor deciding whether or not the topic was newsworthy enough. And I think that's a problem that beyond Ebola is also troubling many freelance journalists. What was the situation like in West Africa as a freelance journalist?
Yeah, thanks, Lou. I spent 7 years in West Africa as a freelancer, and at the time, so this was just until 2013, at the time it was, and still is, an area where there are lots and lots of underreported stories. That was one of the reasons I chose to go, in fact, was because looking as a freelancer for where to base myself and where to work. Many other parts of the developing world, for instance, Nairobi, Kenya, lots and lots of freelancers. I chose to go to Liberia because I saw so many stories that weren't being covered, but that was so fascinating and that I thought people would actually be interested in. So it was driven by interest on my part. But I think what I found when I got there, and what lots of my freelance colleagues found, was that there just wasn't the interest among newspaper editors all over the world. We were working for media in the UK, in the US, in other parts of Europe. And I think there just weren't enough links, enough reasons for them to want to run stories from this part of the world, which is understandable. There are many, many items on news agendas. But we did find that as freelancers in West Africa, we constantly had to fight to get our stories, for them to be given space in international publications. So that was something we came up against. And in creating Ebola Deeply later, we've tried to do the same for freelancers who are in West Africa now, to give them that space so that issues don't slip under the radar because of publishing limits.
And I think there's also a really important reflection point for us in Italy, where freelance journalists are very often under the pressure of just like doing what's interesting for the editors. And the range of topics that we like to cover is very narrow. So sometimes there's really value in being brave and trying to create a space for the public to be informed beyond what the editors deem newsworthy. And in particular, when it comes to international issues and to international development issue, we have to think that we're living in a globalized world. So what happens in West Africa is also our business. And I think that the Ebola crisis kind of showed that, with raising this feeling of paranoia a bit all over the world, and in many parts of the world, obviously, it wasn't really justified, but it really made us understand that we are one world, and what happens far away may happen to us tomorrow. So I think that's a really important point, and I would really like to reflect on that as a journalist. Before we carry on, sorry, you wanted?
No, that's fine, you go.
Before we carry on, I wanted to introduce our last guest, who couldn't be with us today, but is connected via Skype with us. If I manage to make this work, I might need a bit of help. Just to introduce him before we connect, he's an amazing guy who lives in Nigeria. He's a dentist by training, but he created an incredibly successful initiative that managed really to campaign against Ebola, to reinforce public information against rumors that were spreading in the country, in Nigeria and all over West Africa. The initiative, you might find it on Twitter, is called Ebola Alert, and it's gained, in I think less than 1 year, a staggering 70,000 followers and engaging a massive community. It's really, really extremely popular. And he's developed a media theory of how the media can really help epidemiology and public health. So how can you work with the media, using the power of social media in particular, to make things better in a non-conventional way? So I think that's also very important. It's a very important idea and perspective to look at. Now it'd be great if I could have some help with the Skype. Is it working? Okay, cool. Thank you.
So if I can interject whilst we're trying to connect, when we look at
Oh, you pressed one.
is it on?
Now it's on.
Yeah. Just to interject quickly while we're trying to connect, one of the things that we talk about in medicine in outbreaks is public health engagement. And actually, public health engagement is key in outbreaks. It's key to stopping rumours being spread. It's key to giving people proper information about what's going on. And as journalists, you are such a huge part of that. And you can't underestimate the importance of giving people proper information. So that in Sierra Leone, people realised that this wasn't a problem that was confined to the East, which has traditionally been rebel territory. So that in the West, people realised that healthcare workers coming back weren't going to suddenly spread Ebola throughout the country. You know, this is something that's so important to in outbreaks of any disease, but particularly we really saw it in this one.
Okay. Thank you very much. That's very important, and I think we want to discuss that also later, and the role of specialized journalists in health reporting, but also in other forms of reporting. Can you hear us? Hi, Lawa.
Yeah.
Hi.
Yes, I can. Yeah.
Okay, thank you so much for being patient. Maybe we want to do a bit of sound check. Can you tell us something?
Good afternoon, everybody.
Okay, can you hear him? Yeah. Okay, cool. Great. Okay, thank you so much for connecting with us and also trying to make it to Italy. Sadly, that wasn't possible. I briefly introduced your initiative, but I would really like you to explain what you did and why it really matters and why it was different.
All right. Good afternoon, everybody. My name is Lawal Bakari. I am the founder of Ebola Alert. Ebola Alert, we started out to apply.
Okay.
Hello.
Yeah, there are a few glitches, but you are still
Okay,
with us.
let me sorry. Hello. Is it
Yeah.
better now?
Yeah, it's better. I think it's better.
Okay. So we applied social media during the Ebola outbreak. Started off to actually use full evidence from healthcare professionals internationally, most of them Nigerians. But after integrating ourselves the Ebola Health Operations Center in Nigeria, we realized the need to use social media to manage rumors and communicate the right things to the audience that we had on social media. We also were taking advantage of the social media and mobile technology penetration of Nigeria, where in a country of 170 million, we have over 54 million on Facebook and about 110 million active mobile subscriptions. So we
Yeah, that's connection. I disconnected. That's the internet.
Hello.
Okay. Hi, you're back. Welcome back. There might be a
Okay.
problem. I might ask people if you kindly can turn off your mobile phones, because if you are connected on a Wi-Fi, take up some band and make it more difficult for us to stay connected. So, okay, thanks,
Yes,
sorry.
so, no problem. So what we did was we were taking advantage of the social media and mobile telecoms penetration in Nigeria. So due to that, we were sending out just basic information on, we started out just sending out basic preventive information. But we realized the need to have that source of information. So the way you would have like the press secretary to the government. So we realized that we needed to set up like a press center for the EOC. And that being what I was doing, which was that we were in the EOC. It came to giving preventive information to the population. What we did was to gather the professionals at the EOC, from Medicine Sans Frontiers to WHO, UNICEF, CDC, United States. We worked together in developing community health messages where we can now use social media to distribute. Then later on, we moved to set up a center and a web service that people can actually interact with us through. So what we ended up doing was to set up an accessible source of information where people can reach us either via phone call, via SMS, via web service and Twitter. Now, the objective we laid out was just to send out information. But during the outbreak, there was a rumor that salt could cure Ebola in Nigeria. And that changed what we were doing, because we realized the need to now start doing what you might call information surveillance. So information surveillance would be that we have to crawl the web through as many technologies as possible to identify what people are saying. So it is not as important as just getting what people are saying, as identifying.
We are dead. Okay, this is not going really well. Maybe you could work without the video.
Okay.
Yeah, I think it might be better. Okay.
Okay, so let me just stop. So what we did was that we just do basic information surveillance on the web, and then through that we've been able to identify more rumors as they are coming, and we're able to identify the source of the rumor and deal with the rumors from source. Then from there, we realized the need to now provide information for organizations ranging from healthcare facilities who were going to see patients but were not confident of dealing with patients because there was an Ebola outbreak in the country. So what we did to take care of that was that we linked we packaged the standard operating procedures and code and placed them online so that healthcare facilities can download from there. Hotel services and schools can go there to download. Banks, malls, and all can go there to download. Then after that, when Ebola broke in North America, especially in New York, we found out that we had over 15,000 followers on Twitter in a space of like 3-4 days. So that expanded our service beyond just speaking from the Nigerian perspective to being able to provide information support to people around the world. So it means that we have to listen into what is going on in CDC, United States, to what WHO is saying, to what also these mainstream media are saying, like the CNNs and the Bloombergs and co. Okay. So what we were doing was to set up like an observatory where we would be able to provide this information to people that are following us. Shortly after the outbreak.
Okay, so thank you. What I found really, really interesting in what you just said is the way you managed to turn a sort of a local initiative on social media, but still a local initiative, into a platform that really was able to speak to the world. And I think that's an interesting leap and perhaps kind of counterintuitive, because we are used to maybe Western media talking to the world and to the local people as well. So I was wondering...
So let me say something. So like as I'm speaking with you now, there is a report that there's a large number of deaths that just happened in a region in Nigeria. And as I'm speaking with you, I'm sure you've not heard about it, but it's already trending on Twitter. So, and it is trending on Twitter because of these are like community journalists who are not specialists like you and I, or like you. I wouldn't say I'm a journalist, I'm a doctor. But I can say that these are not specialists. But this information is already trending on Twitter, and I'm not sure it might even enter international media, except probably for one reason or the other. So we know that they are, but what we have to do is that we will pick this information now, and we have routed it in the line of the epidemiologist. So we are currently communicating with epidemiologists across the country, and they are following up on these, and they are going about identifying the lab status of these. So we are communicating with the laboratory. So a lot of these kind of things exist. And for instance, an individual can have up to 100,000 followers on Twitter. Mm-hmm. As far as I'm concerned, that person is running a personal mass media, because he can send out an information right now, and you are sure that at least 20% of that number will get that information. That is 20,000 whole people. And God knows how many people are also following these 20,000 people, and that continues to spread information. And by the time it goes from maybe Twitter, it enters like WhatsApp. From WhatsApp, it comes out, it goes into BlackBerry Messenger. It shows that what people are carrying in their hands, people even follow these tools for information than sometimes the TV, especially in communities like this where people don't have access to cable TVs, people don't subscribe to cable TVs, they cannot afford it. Most people just listen to radio. Power is a major issue, so even if they have all of these, they might not put on their TVs in a week or more. So it shows that. And then if you talk about reading, people read, yes, but where do they read and what do they read? Most people don't follow news sites, they might probably follow the gossips if they have to read. So it shows that the source of information for people is changing, especially when it comes to information like Ebola. Okay. They will most probably get it from a cousin who picked it up from a portal online. So earlier in the week, we were dealing with a rumor that started from a blogger who actually didn't mean what she said. She just said there was Ebola in Nigeria. Meanwhile, there was no Ebola in Nigeria. Okay. By the time we found out what she was trying to do, she was just trying to pull traffic to her site. But this had gone viral. It required the federal ministry and the state ministries of health to tackle this. And we had to spend some resources also in ensuring that we tackle this rumor. But these are the kind of things.
On this point, sorry, I just wanted to pick up on this point of new ways in which people really use the media and engage with the media, and ask to my panelists as well here, what challenges did they find in engaging people in their stories, and what type of response were they hoping to receive, and what did they find? What were the problem in public understanding of the issue?
I'll go first if I may. I mean, first of all, in response to that, the first challenge was on a sort of a national newspaper when Ebola was only an issue affecting West Africa, just to persuade them this is a story worth doing, when there isn't that sort of immediate impact in the UK. But I just wanted to address something that Lawal said about the impact of rumours. I mean, in sort of social media world, and I understand, I mean, in Sierra Leone, in Liberia, the way most people get their, the media most people have access to is radio, is that right? So the impact, if a rumour spreads, if a bit of misinformation about Ebola is reported, that can spread very, very far, with quite a dire public health consequence. And that brings home the responsibility upon the media to get their facts absolutely right, even if you're reporting something in the UK, perhaps because of the internet, that is accessible, maybe not accessible to everyone, but there's a chance, for instance, there was a story you may have heard in October when a senior official at the UN raised the scientific possibility, and it's only a scientific possibility, that Ebola, which is a virus spread through contact with bodily fluids, so it's actually relatively hard to catch in most circumstances, could become airborne. Now, logically that is possible, but there's no precedent for a virus changing its form of transmission in that way. However, because a senior official had said that, a lot of media all over the world rounded it down as a very big story, and there was a lot of concern around that. And my newspaper, Sarah's newspaper, shortly after that, sort of ran Q&As and Mythbusters to confirm that while this, is scientifically possible, it's really, really extremely unlikely. It's not going to happen. So don't change your behaviour. And the reason I think that might be, it's not just a factor of getting something wrong. It's that on the ground in Sierra Leone, say that someone checking Twitter sort of picks up on this and says, "Oh, look, the Western media is saying this about Ebola. The healthcare workers told us it was only through bodily fluids. They're lying to us." There's already a massive problem with mistrust of healthcare workers. That's only going to deepen that mistrust, and that just comes back to this issue of the responsibility the media have in this area.
Mm-hmm. And I imagine this might be particularly frustrating for doctors and Geraldine as well, because obviously it must be difficult enough to deal with rumors on the streets and trying to do something about it, but also seeing wrong information being reported on main media outlets, especially Western media outlets, who are supposed to have certain standards of verification, of fact-checking, must be quite frustrating. So I was wondering, what's your opinion and what did you feel?
Is it on? There we go. It's incredibly frustrating when people don't check their facts before they write pieces. And we discussed this business about Ebola becoming airborne at dinner last night, and I had my head in my hands screaming because I was so frustrated when that appeared in the paper. And again, this is, if you're reporting on health or science, you have a responsibility to check your facts and to check who is giving you the information. And in an outbreak situation, particularly something like a viral hemorrhagic fever, like Ebola, lots of people want to be considered knowledgeable and important and offer opinions, but not everybody is. And the person who initially came up with this thought that Ebola could become airborne, wasn't an experienced virologist. So you do need to think about who you're getting your facts from, and it's incredibly frustrating for people working in the field. And sometimes it's dangerous for us if rumours get out of hand. And certainly some of the problems we had in Sierra Leone, and I know my colleagues in Liberia and Guinea experienced the same thing, is exactly what Lawal's talking about, is rumours spreading in communities that treatment centres are set up to steal organs from West Africans and ship them back to Europe. This means that people don't want to come to the treatment centres, so they don't get help. It means that they don't want to come to the treatment centres, so they're not isolated and they pass on the virus to their family members, and more people get sick. And it sometimes puts us at risk, because if in a situation where there's a big outbreak and you may have perhaps 20 patients turning up at the gate wanting to be admitted with their family members, it can be quite frightening, and you can be surrounded by quite a big group of people. So responsible reporting is really important.
I would say, actually, that in the case of Ebola, one of the problems was that all the facts were not known quite early on. We did not report this airborne virus issue.
Nor did we, for the record.
No, for the record, we didn't do it, and nor did the Independent. But I was very much writing that this was not, in fact, true. Every scientist who told me, this gentleman at the back, but who I spoke to, every scientist I asked said, absolutely no way is this airborne. Actually, the trouble was that there was a very, very slight possibility, and there still is, that it could mutate to become airborne. But it's so unlikely that, as Geraldine put it last night, it's similar to the possibility of growing two heads. So it's of that order. But putting aside the airborne issue, which clearly was a scare story that some newspapers may have chosen to run with, all the facts were not known, and that's why I wrote a really big piece that we entitled, or I gave them the title for it, How Not to Catch Ebola, because people were very anxious about this. And I was asking questions of scientists, and they didn't always know the answers. So people were interested in things such as, if somebody came to the UK, if perhaps they had Ebola, they didn't know it, but they vomited or bled in a taxi, there are bodily fluids there. What then? You know, could somebody be infected from the taxi seat? Well, actually, you know, if the stuff was there and it was wet, there is a possibility of that. But the obvious sensible thing to say is it's highly unlikely you're going to get into a taxi of that nature in the UK. You might in West Africa, but not in the UK. So everything had to be measured and tempered, and it was very important that we should put things into context. But you know, we don't know everything about Ebola, and we had to say that. At the same time, the other thing I wanted to say was it's very important that health specialists or science specialists should be covering these stories and not general reporters, because at least we know who to ask the questions of. And to go back to a point that Geraldine made earlier about why it wasn't covered earlier, you know, it isn't, health reporters we didn't know either that this was a massive issue back in March, because the WHO wasn't saying anything. We certainly had nothing from on the ground in West Africa, so it wasn't coming through. MSF were the first people to say that this is a really serious problem. And when they started talking to us about that, then we did respond and we wrote things. But if you're not getting the information, you can't run the story. So for my money, it goes back to WHO and the fact that the information wasn't coming through. And that, as I understand it, was to do with problems around the West African, very often the West African WHO leaders who were concerned about the trade implications for their countries. So there were all sorts of reasons why the information didn't come out, but it wasn't just newspapers.
The WHO leadership themselves, I think, were in the bird flu epidemic of the late noughties, around 2009, I think it was, unless I'm mistaken. There were some senior people in the WHO who warned of, you know, millions of deaths, which obviously, you know, didn't materialise, and it wasn't nearly as bad as they said. And I think the WHO became a bit cautious about overreacting, perhaps. But the man who just co-discovered Ebola, called Professor Peter Piot, who's been one of the main commentators throughout the Ebola crisis and a real sort of voice of reason in a often quite sort of in a difficult issue, has said that he would rather be criticised for underreacting than for overreacting, which may be a good principle for the future, but it is more complex than that, because I think, Sarah, you were saying to me earlier that to declare a country a sort of a massive disease risk, especially such a vulnerable country as Sierra Leone or Liberia or Guinea, such a impoverished country, is not good for that country's trade. It's not good for its economy, and if those warnings do end up being an overreaction, then you've hurt that country's economy for no reason. So they are difficult calls that the international health officials have to make when they make these, you know, dramatic statements about how serious this situation is. In this case, Médecins Sans Frontières saw the writing on the wall and called it absolutely right, and we have to be very grateful to them. And I think Geraldine today was a representative of that organisation, and they've just done incredible work throughout this whole situation.
So I think on this point, I think there's quite a reflection to be made about the responsibility of journalists to get it right when it comes to these international important issues, because there are entire countries' economy that can be heavily damaged if the message that's put out there is not right. So I think that's very important, and it might be a bit scary, especially if you are maybe a young journalist that doesn't have many years of experience behind, as I imagine many of us in this room are. So I kind of wanted to know your opinion on how to go about these important issues if you are a budding journalist, if you are young and if you maybe don't have much experience. The common knowledge would be that if you're young, you should be dealing with maybe just small local problems, and then maybe climb your way up until you have the authority to deal with important issues, with international crisis. But I think there's also a role for young and local journalists to look at international issues. But I wanted to know your, expert's opinion, and also Geraldine, from a doctor's point of view, what was the relationship like with the media, and if she felt that some journalists she dealt with were more expert, or if she found it difficult to deal with less expert journalists.
Well, as far as I've just said, you know, that actually it's by far and away the best thing if a specialist who has had a lot of experience of dealing with scientists and doctors and medical issues, health issues, covers a story like this. Having said that, there were a lot of people who went out from newspapers who were not specialists and were treating it as a foreign story. That there obviously is a place for both, but the person who is the all-rounder, maybe you know, a young journalist who's going to a foreign place they've never been to before and trying to do a story. Ebola actually is not a good one to choose. It really isn't. I mean, it's dangerous. It would be dangerous in those circumstances. And the reason I was able to make an argument to my paper for me going was because I knew the risks, because I'd covered a lot and I'd spoken to a lot of people and I talked to doctors all the time. So I knew how to behave in that situation. Normally, when you don't have a highly contagious disease, although I have to say this one was being contained in the treatment centres largely, and you would be very unlucky to encounter somebody and actually come into contact with their body fluids just through a normal process of journalism. So most of the people who actually did cover it would have gone to treatment centres and they would have put on Wellington boots, they would have had to wash their hands, and they put on some overalls. You don't go into the full PPE, nothing like that. And you keep your distance, because the people you're talking to, if you get to talk to them, as I did, are on the other side of a wire fence, so you cannot contact them anyway. And all the organisations, MSF, but the other NGOs who were out there were very careful about that. So it's perfectly possible to go there and to do the proper job of a journalist, which is to go and observe and to go to talk to people, as long as you're with an NGO who will make sure that you don't do the wrong things. So I also talked to, for instance, people who were in quarantine, whose whole village was in quarantine. And again, I kept a distance, so there was no barrier, but it was from me, say, to the front row of talking to somebody. And you can do that sort of thing, but you just have to be very careful about what you're doing, and you have to take advice from those people who know. And that's always the case as a journalist, you know. So going back actually to the importance of journalists getting it right, I'd say yes, but the way you get it right is by asking people who know. So you go and ask the experts, you ask the doctors, you ask the scientists. If you're lucky, then you've had a lot of contact with them, then it's quite easy to get access to them, and you can quite easily find out what the truth is. But it's very hard if people are not giving you that information, and as a brand new journalist who doesn't have the contacts, maybe it's more difficult.
Can I interject something here on the same topic? And I absolutely agree with what Sarah's saying. The other thing about the Ebola story is that although this was and still is a crisis of health, I think it's a crisis of many other things as well. So often, while of course science and health journalists are best placed to cover the scientific aspects of it, there was definitely a role for journalists who knew the context and culture. And that's something that we noticed was definitely being missed in mainstream media. We had a situation where things were being reported, you know, saying things like, okay, people in Liberia or Guinea are ignorant, they don't understand that Ebola is real, they won't believe the doctors. And that also can have such a detrimental effect on reputation of these countries. So I think there was a role for journalists who could bridge that that gap of understanding just why people were not believing that Ebola was real. And again, coming back to this issue of rumours, which I think that, you know, Ebola Alert has done such an amazing job of working with. But during the time that I lived in Liberia, there were many, many instances where rumours would circulate and would really just sort of flow through the city. It was amazing. So at one point I remember a rumour which basically said that if everybody in one community did not go down to the well at midnight to collect water, the next morning the well would turn to blood and there would be no chance for fresh water. Another time when there was a firework display over the city, and this was only 5 years after the end of the Civil War, and people just heard the loud explosions and they thought, okay, war is coming again. So this rumour again started to spread really fast. Like wildfire, people were running into the bush, they were packing up their things and leaving. And that just sort of illustrates how quickly misinformation can spread. So I think, you know, from the context of the reasons why Ebola happened in these countries, why people didn't believe that it existed, there was a lot of ground to cover for journalists who did know that context too. So again, looking at, you know, what role is there for young, more inexperienced journalists in a crisis like this? Well, again, I think it's something that you need a lot of experience to cover, but if there are regions that you're passionate about or places you want to go to where you can learn, and you can learn very much in the field as much as you can in a newspaper too, which is what I did. I went to Liberia when I was 25 and I learned there. Then there's so much that you can do with that later, and there's, you know, often no substitute for learning about a place or about issues that affect a place by being there. So I think that's always a wonderful thing to do, although quite challenging in ways too.
In terms of the role of the difficulties for young journalists, I mean, I'm only 26. I've only been health correspondent for 2 years, so Ebola was probably the biggest challenge, biggest story I've ever had to face. And it was extremely difficult because, I'll be honest, I didn't know much about Liberia, Sierra Leone, or Guinea. I had not really heard of Ebola before the outbreak. But you have a job to do and you learn very quickly, and I think the thing to do, if you are young and inexperienced, you can't become experienced in the space of 2 weeks, and so what you do is you err on the side of caution and the side of responsibility, because this is a huge story of huge implications around the world. And so you may be young and inexperienced, but the experts are out there and they are not. So you, like Sarah said, you speak to them. You speak to as many as you can, you understand what the consensus is, and then you've got a set of parameters around which you can, within which you can write your stories without getting things drastically wrong. Now, I'm sure as some of you will know, as a young journalist, the big pressure we face is we need a good story. We need something interesting for the front page. Your editor wants you to find the most interesting line. And now sometimes with something like Ebola, that most interesting line might be some expert who's a little bit left field saying something dramatic, such as Ebola could become airborne. And I think it's incumbent upon a young journalist to go with the expert opinion, the consensus of the expert's opinion, rather than throw that away for the sake of a good story. Because that good story might be a great front page. Your editor might pat you on the back the next day, but you might have had a really dire impact on the public health situation in a faraway country, and you'd have to live with yourself if you made that mistake.
And so starting from what Kate said about going in the field and maybe living in a country, if you're passionate about an area, want to learn more, that's another way of building a non-conventional journalistic career. Whereas maybe you can climb your way up from newsroom, so starting working in a newsroom, learning from your colleagues, and developing a network of contacts. So I was wondering, what was your relationship like with the other side of the spectrum? So for those who work in a national big newspaper, actually international, really important media outlets, and for Kate was, on the ground, what was the mutual relationship between journalists, foreign journalists coming and visit the country to learn more, and journalists who have been based there for a while and knew maybe more about the local context? Did you manage to communicate, or there was a lack of understanding, or something could have been done better in terms of synergies? What did you find? What was your experience?
Well, is that on? Yeah. So actually, when I went entirely on my own, and I didn't have any contact with any local journalists when I was there. So I wasn't going to press conferences. I was actually pursuing, first of all, a very big piece that I did, as I said, which was ended up as a 5,000-word long read, as we call it, which was about the quest for a drug. The heroic efforts, in my view, of the scientists and MSF, as it happens, to do clinical trials in an epidemic situation, which is an unbelievably difficult thing. If you think, that normally drugs are trialled in hospitals and under sterile conditions and all sorts of other things, and they were actually doing it in these circumstances. But so I was doing that, and I also did a video and audio diary every day I was there. So, well, it wasn't every day, I was there for 10 days, I did it for 7. And so each night I was uploading my own experiences, I suppose, of and the videos and audios I'd done with people. And those were with local people who were fighting this. So there were people who were working in the quarantine situation with burial workers and those sort of things. I went to see different NGOs and got involved in the projects that they were undertaking. But there were no other journalists doing it. So one of the interesting things was that there was sort of wave after wave of journalists, and a lot of people went out earlier on, and then it all died away because the initial fear had disappeared. So it became a really, really big story in the UK and obviously in America. And from America, of course, you know, everybody listens to the American news, or they're influenced by it. And this whole paranoia set off. But that was in sort of September, October time, something like that. And so various people went out at that point. And there were quite a lot of, there were whole batches of journalists and press officers flown out from government departments to meet them and look after them and take them around places when they got to Sierra Leone or Liberia. But as I say, when I went in early December, none of those were there. And I didn't want that anyway, actually. So I went to Sierra Leone and then to Liberia and then back to Sierra Leone again and then came back again.
Yeah, I think, you know, for journalists local journalists, Liberian, Sierra Leonean, Guinean journalists who were on the ground, and also international journalists who were on the ground during the outbreak, there's always there is a working relationship between journalists who fly in to cover a story and journalists. As I was saying, there is a working relationship between journalists who fly in specifically to cover a story and journalists who are based there anyway. But I think there's often a lot of bridges to cross. Journalists on the ground who live there anyway, they have much more time. So that means that you can sort of get stuck into details of a story that you might not have time for if you fly in for 2 weeks. But at the same time, I guess the agendas are slightly different. A friend of mine who's a journalist who's lived in Liberia for the last 3 years, she likes to tell a story about how at the worst part of the outbreak in Liberia, foreign journalists would fly in. She's a foreign journalist herself. And they would all say to her, "Oh, so you've lived in Liberia for 3 years. Why? What have you been doing here?" And she would say to them, "Well, what took you so long to come?" And I think it just really illustrates how many things there were being reported on under the radar that journalists who flew in for a couple of weeks didn't get to see. So of course that's missing, and I think there's definitely a space for more cohesion between the two. You know, if there's better communication, if there's better working relationships between the two, then stories can be much richer. We worked with a local reporter in Liberia who ended up teaming up with a team from the Washington Post. He worked for a Liberian newspaper, and together they went out and reported on stories. That was such a great relationship because between the two of them, you know, they were able to look at, okay, what's happening on the ground, what's the Liberian perspective, how is this outbreak shaping up, and then what's driving the international news agenda. And then, you know, you bring those two aspects together and you've got something really strong. So I think absolutely there's always a case for working with local journalists, fixers, but also, yeah, I mean, it's a balance. Sometimes it's better to go alone too.
Actually, just to quickly pop in there, I mean, I didn't mean to say that I wouldn't have liked to have worked with local journalists. It just didn't work out that way because I had a lot to do and I just had to get on with it. But from what you're saying, I mean, it would have been a great thing to do. You know, I would have liked to have linked up with people.
No, absolutely, yeah, and I know the constraints. And I think often it's time as well. I've also been a journalist that's flown into places for 2 weeks, and it's difficult. So it's yeah.
And yesterday there was a panel. I think it was in the morning, where journalists did discuss the way the Western media describe Africa. And one concept that came across that I think applies in this case too was that there is a place for different type of journalism. Because obviously you can't really expect the mainstream media will have to put the story out there within a day to just spend 3 years in a local context and get to know every nuance and every, you know, possible detail of the story. But at the same time, there's a value in spending time there and living in a place and being actually a local. So it was interesting to kind of understand how these two types of journalism can perhaps discuss. And one can't really do everything. So sometimes it's easy to blame maybe the mainstream media for being too superficial, but the truth is it's probably about dialogue between the two different realities and the two different types of journalism. Another question that comes about, and I work for an organization who does a lot of training, so we do work a lot with local reporters in the Global South, and we do a lot of training, is how to communicate and measure our journalism according to shared standards. So I don't know if you ever had a chance to communicate with journalists working in the field and being local and people who have been trained in the Global South, and what did you find, if you found that sometimes their sources could be trusted or there was a problem of training, and we discussed a bit that before the panel.
Yes. I think a great deal more training is needed, obviously. I've actually been to Africa a lot. I've done an awful lot of work on HIV and other things as well. And I've met journalists in other countries, although I didn't, as I say, in Liberia and Sierra Leone. But, and one of them, for instance, in Rwanda, I really remember, who was brilliant. She was absolutely fantastic. But the problem that a lot of people come up against is that their newspapers are not structured. They don't have the freedom to work in the same way we did, and she certainly didn't. In fact, she ultimately left because she was being told what to do. She was very much dictated to by her editor, and the government was telling him what she should be writing. So, you know, there was no question of any journalistic freedom there. So that's one issue that does crop up in Africa. And the other one is training is hugely important. And sources, and obviously people don't see the value of sources, how you can respect what one person says to you but not another. And also just writing anything without regard for the sort of libel laws that we have, for instance, in the UK. And we're very, very careful about what we write because we're afraid that people could pursue us. But it doesn't seem to happen in some African countries. But I think other people have more experience, perhaps, of this.
Hello, can I have my opinion?
Hi, sure.
Yes, I would like to speak on the issue before this and this one. So the first one we were talking about expert information. Mm-hmm. I think it's important that we note that in terms of healthcare evidence, there are 4 areas, and one of the components is consumer or patient experience. So, for instance, a patient that has gone through Ebola is not an expert, but might be able to give you a set of information that an expert might not even have. This makes it important that the voice of community experience can really be powerful, in reporting things like this. Then, in terms of the relationship between local and international agencies, I can say that during our outbreak in Nigeria, we also had a lot of great guys who were from, we had guys from BBC and co who were on ground here too, were doing. We found out immediately from the healthcare professionals' perspective is that the foreign-based guys are more professional in reporting, and really calls for some sort of training that we had to organize for local journalists. And then toward the end, we tried to see if we could actually come up with a tool that can serve as like a glossary for Ebola and communicable diseases, so that people can go there and understand how to use different terminologies. So again, in terms of style of reporting, there was a time a South African was intercepted at a Nigerian airport because of symptoms that seemed like Ebola. And by the time it was going to be reported in Nigerian newspaper, the reporter said a South African was arrested. And that created a lot of issues, because when you say you've arrested a person, then it becomes something of diplomatic importance. And that makes it important that maybe schools of journalism in this region might need to upgrade their curriculum, and possibly around the world, to see how maybe journalists at whatever level can understand these basics of reporting health information, because it has a very strong implication on, the entire response. In fact, it became a challenge between the Emergency Operations Center and the entire news media, because it was like the media was always seeking information, and because it was sensitive information, sometimes results are still being expected from laboratory, but media wants to go out, so we have to balance both. But for international, better trained expert, I think they do a lot more. But again, when we look at the likes of CNN, I'm sorry, I think CNN made a lot of mistakes during the Ebola outbreak, especially when it was in America. They made a lot of errors, and it calls for a bit of mediation. That the protocol that we applied in Nigeria was that it was the minister's voice that would lead. So we didn't make media too close to what we're doing because of the nature of information that was going out and how citizens might respond to it. So I feel maybe a media protocol might need to be designed, maybe standardized for how outbreaks should be reported, and these can be circulated around the world so that both local and big agencies can identify how best to get this thing done. Because we believe now that the strength of everybody is the strength of the weakest link. So if the local journalist is doing the wrong thing, like it happened in Nigeria earlier in the week, it might just affect everybody. And this is public health, as much as it is media. This conversation we are having here is actually public health conversation. Thank you.
So you're making also a bit of a case for citizen journalism in a way, so tapping into the potential of people who are experiencing the issue and are becoming experts. So
yes.
I wanted to ask to Geraldine, what was their experience with local people, and if she found that there was a local knowledge that kind of supported the doctors, or if on the other hand the doctors had to combat rumors, and what was this relationship like?
I mean, actually, once people had been in the treatment centre or been involved with us, it was an incredibly positive relationship, and people, particularly people who'd survived Ebola, wanted to come back and work in the treatment centres. They were our biggest kind of positive public health advertisements, and would go back to their communities and be very kind of forceful, telling people if they were unwell that they should go to the centre. It's a really interesting place to be as a doctor involved, being asked to do some reporting. I normally don't talk about any of my patients. I don't disclose any details about them. Everything's confidential. So actually being in an outbreak and being in a situation where someone had asked me to tell some of the story was a really unusual experience. And I think you've got to be really conscious. I had to be really conscious whilst the story was incredibly valuable and incredibly important and needed to be told. These people have a right to privacy as well. So it's really important that if you're going to discuss, if you're talking to somebody, if you're going to report what they're saying, that you make sure, for me, that I made sure that they were okay with it. And I said, we're going to talk about this on the radio in the UK, and 750,000 people are going to listen. Is this okay? And how informed the consent is, I don't know. How much they understood about the audience their words were being transmitted to, I don't know. And one of the things I really wanted to do, but I wasn't able to do, was actually just to let people talk. And one of the difficulties I had was I was recording things on a mobile phone and then sending the audio files back via really dodgy kind of Wi-Fi internet. So it was just a difficulty in gathering information.
Okay, so now also obviously the question would be, from a journalistic point of view, how do you deal with the sensitive issues where the human side is involved? So how do you make sure you're telling the story, but you are mindful of people deserving respect and privacy? And if you have any examples that you came across during your Ebola coverage?
I mean, certainly most of the work I did was very much about individuals, about telling people stories. And there was a young woman who came to our treatment centre who was a healthcare worker from another town. And she died. And I wanted to tell some of her story. And And I thought it was very powerful. She'd been working, looking after people without any protective equipment, and she'd still kept going to work knowing that there was a chance she could catch Ebola. Now, there's been lots of talk in the media about heroes and Ebola heroes, and particularly about MSF, but this poor woman who'd been going to work without PPE, she was a real hero. And then you think about she's no longer here. How do I tell her story, and how do I know her family are okay with it? And actually, we found the mobile phone number of one of her family members, and we rang them, and we said, I said one of the doctors has a small radio program, and she'd like to tell Faduma's story. And the family said, we're desperate to have her story told. We want people to know what's going on here. But I think you've got to try and get consent.
Yeah, absolutely. So you need to explain to people as best you can what you're doing. Yeah, we have an advantage if you're printing it, if you're publishing something in the UK, it's highly unlikely actually that will get back to people who live in rural communities in somewhere like Sierra Leone. That's one advantage. But I don't think you should rely on that at all. So obviously one thing you can do is change names and change circumstances that would identify people, and I think that's a fair thing to do. And there was a particular concern of mine, and other people obviously shared that concern, and I'm sure Geraldine would have done, which was that when people had been treated for Ebola and then they went back to their communities, there was a lot of hostility, a lot of anxiety, a lot of fear. And some people wouldn't have wanted the fact that they'd had Ebola even to be known. And I spoke to one young man, actually, who denied. He was in an Ebola treatment centre saying, I haven't got Ebola, this is something else, they're treating me for something else. And that was the story he was going to tell at home, and quite understandably, because he was worried that he would perhaps be turned out of his village if he went back, having been treated for Ebola. And, there were plenty of examples. There was a terribly sad woman who had Ebola herself, and she was a nurse, in fact, and she'd recovered from Ebola. So she was going back as a volunteer to go and work in a treatment centre. And she told me that the reason that she really wanted to do it was because she had a son, and her son would no longer touch her, would no longer go near her. She got no hugs, no kisses, nothing from him, because she'd had Ebola and he was afraid of catching it. He was 8, and she was just desperate, and she said, I just want to treat children. So, you need to tell those stories, because that's the way that you get over to people the impact of this awful disease. And I'm sure a story like that would be understood by any woman who has children in Europe. So I needed to tell the story, but at the same time, there are clearly these issues for people, and so you have to be very careful about identifying people.
Yeah, we've come across similar issues as well. I mean, it's so many sensitive issues around this. And as Sarah says, so much stigma after people had survived Ebola. A couple of times we interviewed people. There was one woman, for instance, who she was a nurse in an Ebola treatment centre in Sierra Leone, a government-run centre, and she had 5 children already. And she noticed that there was a little girl in the holding centre at the treatment unit. All of her family had died from Ebola. She had nowhere to go, and she wanted to adopt her. She knew that as things stood, this girl she didn't have a change of clothes, she didn't have shoes, she had nobody taking care of her apart from food being given to her at the holding centre. And honestly, very little prospect, because although provisions are being made for Ebola orphans, there are so many of them that it's going to be hard for them to find families to go to, or even orphanages at this point. So she took her home, and her family refused to talk to her, refused to talk to the child, told her that she'd brought trouble upon the family. So she persisted, she kept her there. And in covering this story, we had lots of ethical issues, because at first we thought, okay, well, if we report on this, is there a chance the child could be taken away from her? Could the government place her back in the holding centre? So we did a lot of research, and it turns out that the village chief, where the child had initially come from, had given his blessing. And so after we found that out, we thought, okay, so it's gone through as many systems as it's probably going to go through. And also this woman really wanted to get her story out there, because she knew there were so many other children that needed homes to go to too. So I think this is something that we came across a lot, was people that wanted to speak to us, that wanted to talk about the stigma, wanted to talk about surviving Ebola. They were happy to be interviewed, because often they needed to sort of get their voices across. But then on the other side of the coin, situations where people really wanted their names changed but still wanted to speak. In Sierra Leone, for instance, schools reopened this week, but the government made a very controversial law to say that visibly pregnant teenage girls would not be allowed to return to school after the Ebola outbreak. Particularly controversial because during the outbreak, so many families were affected economically. Parents were out of work, that kids often resorted to prostitution or ended up in situations they wouldn't have done because schools were out. So there's a lot, data is still forthcoming, but it seems NGOs are reporting a rise in teenage pregnancies. So again, in reporting those kinds of stories, we've had to be very careful about changing names just because the stigma is already so high that the government has resorted to that kind of rule. So, yeah.
Thank you. So I'm mindful of the time. We have 10 minutes, so if you have any question, that's the right time to ask. Okay. I think there's one question here. Thank you.
My name is Roberta Villa. I'm involved in a European project about communication in outbreaks. And my first question is about stigma, as you mentioned just now, since I think that I'm asking your opinion about the role of media in preventing stigma in outbreaks, even in not affected countries. Because in this case, for example, the outbreak was in Africa, but there were cases of stigma also in not affected countries, in Europe. Everybody coming from Africa or even living in Europe, never been in Africa but of African origin, were in some cases discriminated, or there were fears about them. And so what is your opinion about this? And another question, a main question I think, is, as Sarah mentioned before, we've known Ebola virus for about 40 years, but yet there are many aspects of this disease that we don't know yet, that the scientists cannot say, cannot be sure that, for example, about airborne transmission, but even other aspects, we cannot really be absolutely sure. And in the beginning of emerging disease, emerging viruses, this uncertainty is even greater. And what I'd like to know is your opinion about how we can communicate uncertainty. Are people ready to accept an answer we don't know? I don't know if you followed the discussion on Facebook with CDC about Ebola, and when people ask something, for example, how long does the virus survive on the surface? And the experts from CDC answered some hours, and people wanted to know how many hours. We do not know. Does this answer produce more untrust, or can be accepted by people?
Thank you. So
I've got quite strong feelings about the uncertainty question, so maybe I can just pitch in on this one, because I get it all the time, because I'm a health journalist, so I'm always writing about the uncertainty in science. And it is very hard, because people think there must be a black and white answer, because it's science, and science must have answers. You know, it isn't like that, and that CDC instance was a perfect case in my opinion. So I think we, particularly we specialists, have to keep writing. There are no definite answers. You know, it's the only thing you can keep saying is it is uncertain, and yet that gets you into some difficulties over issues, for instance, like the MMR. You know, so the question of does MMR cause autism? I was desperate for people to say no, it doesn't, but they won't. They won't say that, and it doesn't. It really doesn't. But there's always a tiny chance it could. You know, and all scientists know that.
We might want to explain what MMR is. I don't know if people know what it is.
Measles, mumps, rubella vaccine. So there was a huge fuss about it.
It's just a vaccine that's very common in the UK, and like I think it's like orecchioni, morbillo, rosolia, and they give it all together in one jab. And there was a study linking this jab with autism, which was a flawed study. It was
It really was a flawed study, and
Yeah.
and it was anyway. That was a disaster, a scientific disaster, and it led to a lot of people not wanting their children to have the vaccine. And yet scientists still will not categorically say no, because they can't. But for that reason, we have to explain that they can't say it. But also, I mean, I really strongly feel that people need better scientific education in schools, because an awful lot of people do not understand the concept of risk, and they need to. It's a basic thing.
On the stigma question, I mean, in the UK, there was a story we covered about a teacher who was coming for a posting in the north of England. She was from Ghana, hundreds and hundreds of miles away from any country that had an Ebola epidemic. And she was turned down for the post because they said, well, we're concerned about the risk of infection. And a lot of people in the UK who don't know too much about Ebola might have said, well, that's reasonable, that's fair enough. But it's not. And I think what the media can do in that situation is to have a very sensitive radar for stigma. And whenever something like that, what some people might consider as a borderline case of whether it's the right thing to do or the wrong thing to do, make a very clear judgment and say there's the wrong thing to do, and to pick up these instances early on so that stigma isn't given a chance to flourish, because when people are afraid, it can.
So just to address the question of why do we know so little about Ebola from a scientific point of view, even though it's been around for 40 years, this is the biggest outbreak by several fold. Prior to this outbreak, we probably had, I think, maybe 1,500 cases of Ebola previously at all, and they'd mostly been in South Sudan, northern Uganda and Zaire. So difficult places to study. We hadn't had the cases. It's a sub-Saharan African problem. You know, if you look at HIV, we didn't start making strides in HIV till it was a problem in America. And the other thing is it's a category 4 virus, so it has to be studied in a category 4 laboratory, of which there is one in the UK. There's a couple in the US. There's, I think, 2 in Europe. So it's a difficult thing to work with, but that doesn't mean we shouldn't.
Okay,
Hello.
one last quick question.
Can I add something?
Il mio nome è Lorella Salce, io mi occupo di ufficio stampa per vari istituti di ricerca italiani e nel caso del paziente zero italiano ho curato l'ufficio stampa per l'Istituto Spallanzani. Volevo sapere dal vostro punto di vista, dal vostro osservatorio, un giudizio su come è stata gestita la comunicazione sia nel caso italiano ma anche negli altri casi internazionali, spagnolo, americano, eccetera. Avete parlato di fonti, avete parlato di importanza della cautela, dell'importanza di non creare allarmismi, dell'importanza di avere una preparazione al giornalismo scientifico, ed è, come dire, sono le nostre stesse preoccupazioni, ma siamo dall'altra parte, quindi per me era importante sapere un vostro giudizio.
Ok, riassumo perché dovrò tradurre, perché non funzionava la cosa.
Ah.
Praticamente lei chiedeva un'opinione sul rapporto tra i giornalisti e gli uffici stampa, giusto? Nella comunicazione dell'Ebola?
Scusa, perché parlava
Oh, scusi.
perché dice che stava funzionando.
No, infatti, però tardi, ha già
Va
fatto la
bene.
domanda. Quindi lei voleva chiedere...
Voglio un giudizio sulla gestione diciamo, degli uffici stampa dei casi di Ebola che ci sono stati in Italia, in Spagna, in America, eccetera.
Okay, that's
Dal
an
loro
interesting
osservatorio, come dire, che impressione c'era? Cioè,
Okay.
volevo un feedback.
Thank you. Okay, so she asked, she's a press officer, and she asked, from your point of view, what's the relationship between press offices and like communication offices in cases such as patients in America or the patients in the UK and the media? So what was the communication like?
Between the hospital.
Between
press
a
offices.
hospital press office, I imagine between a hospital, no? Okay, hospital press office and the journalists that wanted to know what was going on.
Do you want to start?
Yeah, I mean, in the UK, the hospital which has treated 3 Ebola patients is the Royal Free in North London, and I have to say their press office has really sort of risen to the occasion, as it were, because obviously this is a huge international story which has landed at their doorstep. And they've been very good at keeping journalists informed, hosting regular press conferences about the condition of the patient, because obviously there's a huge amount of interest. Whenever someone in a certain country gets Ebola, the country are interested. Whether they should be more interested in the bigger situation unfolding in West Africa is another point. But no, the press office there were incredibly helpful.
The press officer in the UK at the hospital, there was a real decision by the hospital to be very proactive about communicating with journalists, because we know what you're like and that you will sneak around and try and find a story. I'm joking,
No,
but
you're absolutely right.
there was a decision made that we would give out the information and that would be it. Otherwise, and I mean, we had the unit has security guards, and you'd be surprised. You know, people try to get in through the doors to try and see what's going on. So there was a real decision to be proactive about giving out information.
Actually, strangely, I wasn't all that happy with the press officer, and because they issued standard printed bulletins regularly. But I felt that they were controlling the situation very much. Okay, I take the point that if people are going to try to sneak into the unit and cause trouble, then maybe that's necessary. But it's frustrating for me. I don't really like dealing with people who are keeping me at a distance.
Okay, thank you very much. We're out of time, but obviously I'm sure that all the guests today will be able to talk to you if you have further questions once we are out. So thank you very much for coming. Hope that was interesting, and I'll see you around.